Welcome everyone to today's Murray Hill Garage Lunch and Learn. The topic for May is celebrating National Nurses Week, which has actually ballooned into Nurses Month and expanding into Nurses Year. Today we have a few panelists with us. Um, we have two people from the Newark Beth Israel Medical Center. We have Tracy Rose, who is the Director of Patient Care, and we have Patricia Mitrano, hope I said that correctly, who is the Director of PR, Marketing, and Social Media. Also joining us today is the CEO of Remote Home Check, Jeffrey Hill. I am Craig Polk. I'm the Murray Hill Garage Innovation Leader, and also on the call with me is from the Murray Hill Garage and Nokia is Rick Smith, who does work as well with us for the Murray Hill Garage. So before we get into our hearing from our guest speakers, one of the things we'll first talk about is appreciation, because we hear a lot about appreciation for our nurses, all of our medical staff during this difficult time, or those in the New York, New Jersey area may have seen the Blue Angels and the Thunderbirds recently fly overhead. So here is a montage from the drive.com that shows the formation that they were taking as they went over New York City and parts of New York and New Jersey. There's also been lots of other ways that appreciation has been done. We can see in the background over here, we have a drawing from my daughter that their school and many schools have been producing drawings and sending to hospitals and first responders to show a way of thanks. There's been a whole slew of other activities that have been going on to try to show appreciation. And I know at this time, especially when I talk to my children, I talk a lot to them about being thanks, not just now, but especially now, to how we're thankful for our doctors and our nurses, our first responders, but also for people such as that work in grocery stores, our teachers, our students, our sanitation workers, everyone in our local, state, national government that's helping during this critical time, and as well as to neighbors, people in our community, and everyone from homeschool teachers that parents have just had to take on some of this responsibility. And we're trying to show them that even though this is not an easy time, there are ways that we can help people, and showing appreciation is a real big way to thank people for all that they're doing. So one of the things I want to share with you right now is a little video really about who are we thanking during this month and why we're thanking them and all the things that they do. And one of the things that is done in appreciation of this month is people wear blue. So we'll talk about that a little more. Okay. So, welcome back, everyone. So, I think that was a very powerful video that got a chance to show some of the amazing things that nurses do. And now we're moving on to our discussion part about what does nurses appreciation mean to you, where we're specifically going to be talking about some of the techniques and innovations in the medical community. But before we move on to that, I wanted to give a chance to let you get to know our presenters a little more. So first, we're going to introduce Tracy. Tracy is a board certified psychiatric and medical health nurse. She's a registered nurse at Newark um, Robert Johnson's Beth Israel.
Israel.
Yes, thank you, hospital. So welcome, Tracy. Thank you so much for joining. And I wanted to give you.
For having me.
It's amazing that you're able to attend in this crazy time. So I just wanted to hear a little from you of what the situation is like you're seeing at work and how important you think at this time is to really show our appreciation to nursing.
Okay. So, again, thank you for having me. It's been a very interesting time here, as I'm sure you can imagine. Just about everything is different from the way that we are delivering care and the structure of the way we deliver care. It's been quite a challenge, but it's also been a really in a strange way, it's been kind of a good experience because we get to see what other people do and we get to see how things go through other people's eyes. We get to step in other people's shoes because we're all being asked to do something different. For instance, specifically for me, I'm the director of 2 of the inpatient psychiatric units, and to help accommodate the hospital to accommodate more COVID patients, we closed our units. So my staff and myself, and also the staff from other departments that have closed, have been redistributed throughout the medical center. So we're all kind of being placed into positions that we never thought we would be put in before. I am now in kind of a management position overseeing 3 medical units, which is not something I was ever planning on doing, but got it was a really great opportunity to be able to work in that environment and get to see how this illness is affecting the patients and the staff and the families, and just the impact that's happened that we're seeing with everyone. It's been a difficult journey. It feels like we've been doing this forever, even though it's only been 5 weeks or so. We are starting to see a bit of an improvement. It's not as acute as it was a couple of weeks ago when we were kind of in it and not really feeling like we would ever get out of it. And just reflecting on this time, I was thinking of an instance that happened. I guess it was the first week that we were doing this. I was on the medical floor with 2 nurses. One nurse was a pediatric nurse. The other nurse was from that unit. And I was at the nurse's station, and I got a call. The phone rang, and I answered it, and it was from our tele monitors who are in a separate room. They monitor the patients who are hooked up to the heart monitors. And she said, you need to go check on the patient in room 11. So I went and I found a nurse, and I told her, and she said, that's not my patient, but I'll help you find the nurse and we can go see what's going on. So we found that nurse and we went into the room, and we could see that the patient was dying. He was a COVID positive patient. and he was a do not resuscitate patient, so we didn't, we weren't going to do any intervention to save him. So the two nurses got down on the floor because the patient was kind of, in like a fetal position towards the end of the bed. So the two nurses got on the floor and they each took one of his hands. And I stood a little bit behind them and held his hands as he died. And the whole time we're telling him that, it's okay and he's going to be okay and he doesn't have to be scared. And after he passed, the psychiatrist that I work with, our child psychiatrist, was on the unit as well, and we found out that neither one of the nurses that were with him had ever dealt with losing a patient before. So we didn't really have time to talk about it or really process it. And we also didn't know what to do with the patient, after he had died. So my psychiatrist and I said, okay, let's figure out what we have to do. So we went back into the room and we did everything that you have to do for the, like the postmortem care and everything. And at one point we were standing on opposite sides of the bed, and I looked up at our psychiatrist and I said, this is the epitome of what COVID has done. We have a psychiatrist and a psychiatric nurse caring for a deceased COVID patient. It's just we've all been asked to do something that we never thought we would have to do. In the beginning, I think we all thought that we wouldn't be able to do what we were being asked to do. But now that we're coming out the other end and we've been doing it for a little while, it's an amazing feeling to know that we have been through this and that we survived and that we are a stronger team now than we were before, because we've all had to go through it and we've been going through it together.
Wow, thank you so much, Tracy. That's a very amazing story, just to kind of showcase some of the things that are happening multiple times a day, not just here in New Jersey, but across our country and across the world. So it really shows the power of nursing and how involved they are and how they're able to stretch from what they're typically doing during this time of crisis. So thank you for that. I also wanted to introduce Patricia to our audience. So Patricia also works at the hospital. She is involved with the healthcare communication, and she leads a team to promote the health services through the community, and really to showcase how they have a impact on the world's health. So thank you, Patricia, for also being able to join us today as we talk about nurses and our appreciation for nurses. And being in the marketing and on the communication side, we hear a lot about how information is meant to what should we do during this time, and we get some information coming from stories like that Tracy has mentioned. So from your perspective, do you think the community at large is starting to get a better understanding of really just what's occurring during this time?
Yes. Good morning, everyone. Thank you, Craig, and thank you for having me. And yes, I mean, what Tracy had said about we are experiencing a little plateau and a slight decline in the amount of patients. So to me and to the rest of the folks at Newark Beth Israel, I really believe that the community is doing what they're supposed to do to stay at home and to prevent this virus from spreading. So the stay-at-home order, I believe it is working. And also, from our perspective, we've gotten a lot of community support from all over this part of New Jersey and elsewhere. Just like you said, your drawing behind you is delightful, and if you once visitors are allowed back into the hospital, you will see that these cards are on the bulletin boards. Wherever there's a free space, we've placed them, and the littlest note of thanks, like thank you for coming in, really makes a difference. And you had also mentioned the Blue Angels and Thunderbird flyover, and we were able to get a few, maybe about 50 or so staff out on our roof of our 9th floor parking garage to see them, and they were specks in the sky, but we were amazed at the way that they were able to coordinate their flight paths, because it felt like they flew exactly right over the hospital. And we recorded that and posted it on our Facebook page, Newark Beth Israel Medical Center, in order for those who were unable to attend could see. And we've just, my job is just to capture some of these precious moments and ways that we can identify some successes. I mean, there has been a lot of tragedy, but there are patients being discharged, and when we can, we do what we call a clap out, where we wheel them out. Sometimes our CEO is the one pushing the wheelchair, and we assemble like a receiving line and just cheer them, because it's inspiring. Our patients inspire us, and it's inspiring. And to see them, we hope that it helps them continue on their road to recovery.
Yeah, there's lots of amazing stories that are going on, and as you mentioned, in Facebook and in lots of social media outlets, we see just how much some of these stories impact people, and the amount of coming together that's being done in a community is really amazing during this time. So thank you very much for that as well. What we're also welcoming Jeff Hill. Jeff is the CEO of Remote Health Check. He has over 15 years of IT and medical equipment experience. He's been speaking at many events, such as the Security Industry Association's annual conference, and has been a presenter at the International Security Conference and the National Association of Broadcasters. Currently the CEO of Remote Health Check, which is a non-invasive AI-driven predictive monitoring platform. And we heard Tracy mention before of some of the aspects that are done in monitoring cases. So Jeff, I was just wondering if you could tell us a little bit more about your company and what it really means to do some remote monitoring during this time, and how that can be helpful to our medical community.
Absolutely. And, Craig, thanks so much for having me. I really appreciate the opportunity to chat. And I'd like to start off by saying, both Patricia, and Tracy, the stories that you guys are telling, there's so many people out there who get nervous to go to the grocery store, the mask on, and go out into that. I think Nurse Appreciation Day is a day for all of us to really look at the healthcare providers across the country and say thank you. And I think that it's a really wonderful opportunity for us to really explore and understand the needs. And I've already just hearing you guys speak has been so wonderful. To really think about how I can make a difference with technology. So I'll back up a little bit. I started my company because my father has a condition called mild cognitive impairment, and it's akin to dementia. And hear these horrible stories right now get into senior care communities, it becomes a really rampant problem because a lot of the people in these communities have medical conditions that predispose them to really having a severe reaction. And there are healthcare people who are working in those types of situations as well. And one of the things that's kind of scary is that we have about 48, 49 million seniors at any given time in the United States who require some additional care. And what we know today is that we have a huge shortage of caregivers in that space. There are actually twice as many caregivers today who are completely, unpaid, like family members and things like that, who are helping out seniors. And then we have a shortage of caregivers who help with seniors. And so, connecting people who are in need of assistance with caregivers is one aspect of our system. But really what we wanted to do with Remote Home Check, and the reason I started this business, was to be able to have an understanding of how someone is doing when you can't be there. Quite honestly, I can't think of a better time right now to be able to have that understanding, to know if someone might be at risk of having, a coronary, or heart condition, a heart problem, to know if someone might be at risk of falling, to know if someone might be at risk of wandering. This is a really important time to be able to understand that, and we can't always be there. And that's really using non-invasive technology, as you alluded to, Craig, is really what allows us, using technology that's been around for a long time, we can now use that in a new way and add intelligence to it that allows us to understand what are called the activities of daily living, which are key functions to how seniors are doing. Now, you guys talked about change, and I can tell you on the technology side, we've absolutely seen change, and the ability to adapt to change be really key things. This was kind of the focus of my business, and one of the things we work with substantially in our every day-to-day kind of role is how do we integrate in other software and hardware. There's so many wonderful solutions out there in healthcare today. How can we bring it all into one place so it's not, cumbersome to use, make a single interface, if you will. And so that integration really led to some interesting tools that we are trying to integrate to be able to help to keep COVID-19 out of senior care. So by being able to do things like thermal monitoring and being able to do the very quick COVID test, really I think the way that we keep this virus out of senior care communities is by preventing it to get in. And so that's one of the things that we're focused in. And then, as you kind of alluded, I've been in IT for quite some time. I spent quite a bit of time in the healthcare industry as well. So I even found myself and some of my team members jumping back in, getting into the PPE game and seeing how we can connect people with people who are looking. That's been an interesting scenario as well. But, again, I think that Nurse Appreciation Day is really an opportunity for us to look at how we can continue to use remote tools, especially the Internet of Things, to be able to have a true understanding and augment the caregiver routine so that we can keep them out of harm's way and still provide predictive insights into what's going on with people.
Yeah, thank you, Jeff. That's definitely something I know from technology aspects, which are from a company like Nokia that provides communication services. That's something we're always looking to do, is to better connect people and give people tools that they're able to use in a way. So one of the things Jeff mentioned was this use of IoT, the Internet of Things, and 5G. And, we've heard always in the media about how this is going to help people be able to get more of what they want, maybe be able to post more things on Facebook, do more things on Facebook. But Tracy, I was wondering if you could just mention briefly what if hospitals are looking at any type of expansion of new technologies, mostly around what has recently happened, to try to think of how to maybe use technology to help with things like patient monitoring or patient care as we move either through this time or after this time.
Okay, so one of the things that we've been doing for our patients, our outpatients, we've been using telehealth a lot so patients don't have to come into the hospital to be seen and risk exposure. We didn't really have that service before this. We were doing, in my department, we've been doing telepsychiatry for a little while now, but and we've had success with that. But it's good to see that we're moving, we're using that throughout the hospital, not just in psychiatry, especially during this time to keep people safe. We've also been doing virtual visiting with our patients since we're not allowing visitors in-house right now. So we have a bunch of iPads that were distributed to all the units, and we go around to each patient who either doesn't have their own phone or isn't capable of doing it themselves, and we will either hold the iPad up above the patient so their loved one can see them, and we help facilitate doing that. So any type of technology that can be utilized to help lessen the tasks that the direct care workers have to do is beneficial, because then they can focus on actually providing the care. Like I mentioned before, we have telemonitors who, there's a room where a whole bunch of people sit and watch these monitors. So the nurses don't have to be the ones to watch that, and then they call and let us know when there's a problem. So anything really that can be used to, like I said, to decrease the workload on the nurses, and on the physicians and everyone on the treatment team, that's something that we certainly are looking at, into the future. And I think COVID has allowed us the opportunity to look at these things and see what areas that we could implement new technology to make our care safer and more efficient.
Thank you, Tracy. Patricia, before we were talking about some of the aspects that the communications team and the marketing team, how they're working a little closer with the nurses to try to kind of take some of these stories and follow up through. So I was just wondering, what was your view on technology use as we transition out of this time into when we're more out of lockdown state?
Well, my thoughts on the way that the technology is going to benefit healthcare going forward is to enable us to keep closer contact with our employees, because like nurses in a hospital that operates 24/7, not everyone has email, and not everyone has a moment to read a newsletter or to check the bulletin board or read like a 4 or 5 page document. So what we're thinking is creating more communications that are smaller chunks, like and also looking into apps that can connect with employees from their cell phones, whether they're cell phones that we provide as a medical center, or they can opt into their personal cell phones. So, and that is something that for crisis communication is absolutely necessary. So I think the use of the mobile technology is going forward, the iPads, the virtual visits, the telehealth. I'm very interested in those thermometers that can take your temperature without sticking anything in your mouth or ear or any other, to make sure that it will prevent the spread of diseases, hopefully not just COVID-19, but in general, keep us a healthier society. And we try and, well, of course, this Nurses Week will be different this year, because we usually have a guest speaker, and we have an awards ceremony and a luncheon and a lot of happy things. But we do, I don't think it's a secret, so I could share the red carpet on Wednesday. I think Tracy knows we set up a red carpet in the employee entrance lobby, and I will surprise all the nurses and employees as they come in on Wednesday morning with music and um, pom pom, a little bit of a celebration to uplift them on their way to doing their heroic jobs.
That's an amazing idea. Just getting to treat them as the stars that they are in the medical and superhero world as really they are today. So one of the things you mentioned, Patricia, was about really just getting information of the employees, extending to patients, and one of the things I'm wondering, and maybe Jeff will be able to help shed some light on this. The data that is collected from home monitoring, really, either after someone leaves a hospital or is getting treatment at home. Has there been any studies to show how helpful this is, and if it's too early at that stage, what are your kind of thoughts of how helpful having this additional information on people, either for themselves and for the medical community, is?
Sure. And I'm happy to answer this question, and I have to say that I'm really excited about 5G and the opportunity that it brings. Things as simple as, when you go into a doctor's office or you go in, you have a health appointment, and you take your temperature. That's a snapshot in time of your temperature. Well, there's no reason we can't have a historic outlay of the previous, 6 days that you've been feeling ill, or, to have a complete understanding of that information paints a much better picture and understanding for a physician or practitioner. The other piece that we see is how Medicare Advantage right now is really starting to play a big role, and Medicare is really starting to acknowledge some of the things we've talked about around telehealth. And one of the things we're focused on from a telehealth perspective is how can we make a telehealth experience that much better? Right now, you call, you talk to someone, they kind of look at you, maybe you open your mouth, but what if we were able to take blood pressure? What if we were able to take temperature? What if we were to identify changes in behavior or activity? These are the types of things that we can do passively, again, without cameras, that help us to understand, hey, you might be suffering from either a condition that requires you to come in, or we might be able to have a better understanding remotely as well. So a big place that we've seen this with seniors, and this is true for sepsis folks who come down with sepsis, heading off to UTIs is a huge way that we can decrease sepsis usage. So being able to do things like just understanding how many times you're using the restroom, the frequency of using the restroom, are all things that we can monitor and be able to head off things that are oftentimes very expensive for hospitals, like sepsis. Another one that we see that is really fantastic is, if you do an ultrasound image today, if you go see a different doctor or you have it done at a third-party location, they're going to try to hand you a CD. I've had this happen. Take this into your doctor, take it into this office. With 5G now, the ability to send data in large files like ultrasound files, or X-rays or EKGs or whatever, we can now send that through the network rather than having to actually make a copy of that, risk it being damaged in transit or what have you. So there's a lot more flexibility that will be able to take place now, just from the day-to-day operations perspective of kind of the IT that's intertwined with healthcare as well.
Thank you very much, Jeff, for those insights. What we're doing now is we're moving to our Q&A portion of our webinar. So for all of our attendees, on your WebEx screen on the bottom, there's the little more feature where you can submit any Q&A questions that you've had through this session, or anything that you would just like to ask to one of our panelists that we have there. We have a couple of early submitted questions through email, so we're going to start with those. And as we go through those, feel free to ask any additional Q&A, and we can hear from our guest speakers on these topics. So the first one is really for Tracy, because there was a question about the activity and hours that are now going on at hospitals and for medical staff. Have you seen an increase where more people have had to work extended shifts or longer shifts or back-to-back shifts during this pandemic?
I think we're all working a little bit more than some of us are working a lot more than we normally do. And part of that is due to, a lot of our workforce was ill, either with COVID or, COVID-like symptoms. So we've been working with a limited number of employees who are coming into the medical center every day. So nurses are working more hours. The way, like I said before, the way the structure of how we deliver care, we, modified a little bit. So some of the physicians are working hours that they don't normally work. I think our CEO and other, upper management level staff have been coming in every single day, just to support the staff. As a manager, a director, we've been coming in to support the staff. I've been coming in 7 days a week for the past couple of weeks. So we've all been giving more of our time. Our workforce is getting better. We have a lot of people coming back to work now that they have, where they've gotten better and are healthier, so they're able to come back. So the nurses are kind of getting a little bit of a break. There's not as much overtime that needs to be that we need to rely on. But I'd say, yeah, everyone I think has been working more than what they normally do.
Thank you. So just to be fair for our Q&A and our email, we'll just kind of jump back and forth from Q&A questions to email questions. So we have a question. I'm going to direct this at Patricia, but we also want to hear from Tracy related to virtual visits. So kind of the first part for Patricia is the hospital doing anything to highlight or market or do some public relations around virtual visits and the effectiveness of this? And then the second backup to that, we can hear from Tracy on, is this something that's becoming standard now as people leave the hospital? So we'll hear from Patricia for the first part.
We're focusing on the external website to get a lot of the information out. On our website is information about telehealth, which has been available for a while, where you can log on and just be seen by a doctor. And that, I'm sure, is going to be very popular going forward. And now what we've instituted since this has happened is, like we said, our outpatient departments have closed, and and patients want to see their own doctor. So our Newark Beth Israel doctors have been seeing patients via telehealth, which will probably continue, because once things slowly get back to the new normal, we'll probably have to space the visits. So either you come in or you see the doctor online in order to remain safe. And I forgot the other part of the question.
That's okay.
But
that's
we're trying. I know a lot of people are online. You may hear radio announcements from all the healthcare systems throughout New Jersey about telehealth. We have the billboards on 78 near the hospitals, and we're trying to get the word out in as many different communication ways as possible.
Thanks. Tracy, for that second part, for the patient care, specifically to help with their mental and emotional status as they leave the hospital and get back to their homes, is this something now that's required for follow-up virtual visits, or something you may see as becoming a requirement?
It would be nice if it was a requirement. We currently are offering our mental health, behavioral health outpatient services via telehealth because we're not seeing patients face to face, which is difficult in behavioral health because often you need to have that contact with someone. But doing the telehealth is better than not having anything. So I think that it's definitely a resource that we should take advantage of. And like I said before, this circumstance is allowing us to kind of test these things out and see how the patients react to it and see if it's something that they find more comfortable. A lot of people, I'm sure, would rather stay home than and be able to speak to their provider over the phone or over, on an iPad than having to leave their house and go to the doctor. So we don't know when we're going to start scheduling, in-person visits again. So I think that this is definitely something that we can use in the future during, the new normal time, not just during COVID.
Thank you. We have a question for Jeff related to the kind of involvement at home use. Does your product now, or do you anticipate in the future it has such a level of tracking that we know when people come to see patients, for some people that have partial home care service?
Absolutely. And so kind of what was touched on a little bit earlier is, it's not just about the residents, it's about making sure that the caregivers are doing, well also. And so we've actually built in, and just to be clear, we have two different solutions. Okay, so we have a solution called Remote Home Check, which is obviously for homes, right? And that's where we want to empower senior citizens to be able to stay in their own homes. Right now, that seems to be a really resonating message. On the other side, we work with senior care communities, and we work with individual, people with their individual conditions and tie that into one bigger system. So yes, the technology is there today for not only technology to be tied together to provide a holistic kind of single understanding of how someone is doing, but we're also getting to the point where we can tie in services now, and being able to order food, or tying in telehealth has actually been a huge focus of us for our company right now. We've been tying in both telehealth services for uninsured folks, and then we've also included telehealth through insurance as well. And Tracy was talking about the importance of mental health. I think that's another huge thing to focus on right now. We offer a basic kind of concierge when it comes to mental health. A lot of times there's a lot of stigma around mental health and questions around, do I see a psychiatrist? Do I see a psychologist? Do I see a therapist? Do I see a counselor? We actually have someone who is certified who can help put you in the right direction, and then be able to provide those services from a mental health perspective as well. So those are some of the things that we see as being part of the new normal that Patricia referenced, and we believe that Medicare, and we see this, is really starting to step up to include these services. So I do think that this is going to be something that we'll start to see a part of the overall healthcare aspect of it.
And that'll be interesting to see how that all comes together in the future. We have another question for Patricia related to if if the hospital has any PPE shortages, and we've seen lots of social media and places like Facebook where there have been stories of getting supplies to hospitals. So One, do you know if there is current shortages, and how well is social media helping to address some of those shortages?
Well, from my perspective, I know a lot about the donations that are coming through, and there have been donations from corporations, and it could be anything as far as a face mask, a meals for our employees. I know that there are many schools, their technology students are using their 3D printers, and we've gotten a lot of face shields donated, which I think is really really super. So I mean, we can't we do what we can to share this information, but I feel that the community and the response is coming from the heart. So we can, whatever we can accept, and that's handled through another department, we do, whether it's something small, like, I mean, there's been hundreds of sewing groups that have sewn the masks, and they're quite popular here, just for the non patient care folks like myself, who I mean, this is the first time I've seen Tracy without a mask in 6 or 7 weeks. I was like, oh my, our face looks a little more round because we're stress eating. But
Yeah.
you know, it's there's so much, and from what I've seen, there's a lot coming through, and it just touches our heart. It's very 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 rewarding, and it keeps the staff on going.
Yeah, it's been amazing to see all of the stories from schools along all the levels down to uh, pre-K all the way up through college that are doing their parts, and companies that have changed things like their assembly lines to help with production of materials for medical communities. You mentioned about the eating, the stress part, right? And I know from myself, I have put on a couple pounds, and my wife, who's a teacher, they have a joke that they relate the freshman 15 from when you go to college to now the COVID 15. And so we have a Q&A question, and hopefully, Tracy, maybe you can shine some light on this. With all of the extra workload and stress that's under the medical community, how are you coping with this stress, and what are some of the recommendations you would give to people in a medical community as well as somebody who's home to try to help with this stressful situation?
So I'll tell you first what the hospital is doing to address that. Our hospital leadership is doing a great job at making sure that we are participating in self-care. So for the past several weeks, twice a day, we've had one of my dance movement therapists has been doing 30-minute like relaxation meditation sessions. So she'll do one in the morning and then another one at lunchtime, and sometimes she does it in the afternoon. And we now have another one of our therapists doing it on the overnight shift. So we're encouraging our staff to go to that because it's great. I've been going a lot of days where it's just 30 minutes where you get to sit and relax, and whether she's just doing deep breathing or yoga, it's really important to take a couple of minutes from your day, regardless of how busy it is, to focus on yourself, because if you don't take care of your emotional well-being, we're all going to have a hard time when this is over, because we've been in crisis mode. So we haven't really been focusing on ourselves as much as we should. I think that once this starts to slow down a little bit, we're going to have time to reflect and process everything that we've seen. And I think that is the time when we really need to make sure that we're taking extra care of ourselves. We also have our patient experience department put together, I think they call it the Zen room, where it's a room that has, low lighting and aromatherapy, and there's tea and coffee and just things to help you relax. There's puzzles, things that you can color. So even if you want to just take a couple of minutes out of your day, like if you're just having a moment and you need to get away, you can go in there. And then last night they opened up my unit and made it kind of a fun zone. We have a ping pong table, some other cards and puzzles and stuff like that. So the hospital is doing a really great job of making sure that we are taking time for ourselves and trying to have a little bit of fun in the middle of all this, if possible. And for people at home, it's, I know it's difficult when you're, quarantined and you can't go anywhere, but if you can get outside and take a walk for a couple of minutes, even if it's just around the block, get outside, get some fresh air. If you do yoga, do that, just anything that you enjoy, to make sure that you make time for that for yourself every day, because self-care is so important and it makes such a difference in our resiliency and how we're able to deal with things. And when things are in a crisis mode like this, we often don't have time for that, or we forget that. But it now, even more so than normal, is when we need to focus on doing the things that make us happy and the things that bring us joy.
Yeah, those are great words of wisdom. So now we're going to have some of our closing remarks. So, Jeff, we can start with you. Just any last kind of pearls of wisdom you would like our audience to have, or make sure that we take away from today's session?
Yeah, I always like to kind of put this out there, just because my dad is a senior citizen, and we are kind of sitting on this precipice of technology. And I encourage everyone, as we look at all these different technology solutions, really look at who is a good ambassador of our data, understanding who is responsible in using data responsibly. That's one of the things that we really pride our company on. And it's something that I really think we all need to pay more attention to. I think we've all seen how technology can be so instrumental in every aspect of our lives at this point. So really understanding the technology a little bit more than just the surface level, when you start to talk about your private information, who is good stewards of our data, and those are the companies you want to be.
Thank you, Jeff. It's definitely good for everyone to take a look at that. Patricia, do you have any closing items that you would like everyone to take away from today's session?
Yes. This pandemic came about, and we're in the midst of it. And for myself, I try and think of what I'm learning, and what everyone, the experts say, that what you stop living when you stop learning. So learning how to do remote conferences like this, to learning maybe a new skill, taking up yoga, you name it. Read more, learn a little bit more. I mean, I know a little bit more about world geography now than I did before, just focusing on the map and what's happening in other countries. And I feel more of a world citizen now, so that I'm definitely going to prepare more, learn more about what's happening outside the United States. So, to try and think of the positive, celebrate your heroes, whether they're nurses, physicians, like you said, everyone who is keeping our economy together and making sure our supermarkets have nourishment for us. It's really a time to be thankful for that we are living in this country. So thank you.
Thank you. Tracy, I guess we can end it off on you for any um, items you'd like our participants to take away from today's session.
I just want to say thank you to everyone for for inviting me to participate in this. It's this Nurses Week and Nurses Month is a lot different than it normally is. Like Patricia was saying earlier, we usually have fun things and events going on, and this year is much different because we are just so focused on caring for these patients. I think I want everyone to know that the strength and resiliency and compassion that we see every single day it amazes me, and it makes me so proud to be a part of this facility and to be able to take part in something like this, as difficult as it is. And the number of days that I've gone home crying is too many to count. But we all come here every day and we're in this together, from our CEO all the way down. We're in this together. You walk into the medical center and everyone is in scrubs, so everyone is on a level playing field, and it's really been quite an experience. We're not through it yet, of course, but I just want to say thank you to everyone, because the support that we have been seeing from the community and from corporations has just been amazing. So thank you again.
Oh, thank you. And to steal a line from my coworker Rich, that's on the call. Thank you, Tracy and Patricia and Jeff, for your time and your insight being here, and all your sacrifice to the community to get back to more of a healthy place and remain healthy. So you're definitely worthy of being called a hero. And my book, and in the words of my children, you guys are all superheroes, much better than what we read in the comics. So thank you very much for keeping us safe. Make sure you also stay safe. And thank you again for this insight and sharing some time with us to get a little more insight and allowing us to show some of the appreciation we have for you. And for all of our attendants that are on, thank you very much for taking the time out of your day to hear from our speakers. And remember, it's Blue Day. So on our Yammer, remember to post any pictures, put any stories of how you want to share some appreciation you have for anyone in the medical community. And thank you again for all joining, and best wishes on a great day and an awesome weekend.
Thank you, Craig.
Thank you.
Thank you all, everyone. Bye.
Bye.